Welcome to The Topic, where we highlight Houston Community College, our students, our programs, and our reach into the community. I'm Todd Duplantis. When the unexpected happens, emergency medical services personnel can make the difference between life and death. HCC prepares students for a future in that lifeline. Program Director Vickie May joins us. Thanks for being here on The Topic.
Hi, thank you for asking me.
Now tell me, the EMS program, what are the certain pathways that student can take, and what are the job possibilities?
Okay, so we have 3 levels of certification.
Okay.
You have the EMT Basic that will take a student about a semester to obtain. After that, they can go out and get a job. Then once they finish their basic training, if they want to become a paramedic, then they'll go through the AEMT training, which is about a semester and a half, and then to complete paramedic, it'll be another 3 semesters.
So you're looking at a total, if you wanted to go the full route, over
About 2 years.
two-year
About 2
program,
years, yeah.
or as little as 1 semester if you want to get your basic training.
Right.
Now, what type of jobs are out there with the different types of certifications?
At the basic level, the majority of the folks will get a job either in the ER as a tech, or they can get a job with a what we call a private ambulance service. They're the ones that take people from hospital to hospital, home to hospital, that type of thing. Some of the basics can get a job at 911, which is what we see on TV.
Right.
Once they move on into becoming a paramedic, then 911 jobs are usually the way they go with that.
If you want to be an EMT, it must take a special calling. Are you looking for wanting to help people, or the fast-paced lifestyle? Are people thinking it's a lot like what happens on TV?
Well, to a point, it is similar to what
Right.
happens on TV, because it's a very autonomous job, because you're working with yourself and your partner in the back of a unit, using protocols and medical direction to guide you through what you need to do for the patient. So it's not a 8 to 5 type of job. You are out in the community, but you do have to want to have that desire to do well and help a person, and to a point make a difference in their life in a bad situation.
What's the popularity with the program? And what are the students like? Are you finding it's more young people or a mixture of all?
It's a mixture. We get them anywhere from 18 fresh out of high school to some of them come to us in their 50s.
And the popularity is rising or increasing, or would you say the same over the past few years?
It's pretty steady. You know, when the job market's good, the student body isn't as plentiful.
Sure.
But we stay pretty steady. We offer courses at the Katy campus, at the Missouri City campus, as well as the Northeast campus. So we stay pretty busy.
And I guess a lot of folks are wanting to know, well, if I just take a one semester certification, what are the salary that I could be expecting? And if you take all the certification and you go through the 2 semesters, what type of living can people earn as an EMT?
As an EMT basic with just the 1 semester of training, they're probably going to get paid somewhere between $12 and $16 an hour. If they get their full paramedic, then typically they're starting anywhere between, say, $45,000 and $60,000 a year.
Do you guys help them with job placement as well?
We do not, but believe it or not, most of our students, because we have a clinical component.
Right.
So when they go out into the clinical setting as a student, a lot of them are offered jobs. And really and truly, we have about a 96% job placement, even without us helping them out.
Tell me about that clinical component. What does that involve? Is that more or less a lab?
Well, they leave us and physically go out into the hospital setting, or they go in to ride with the EMS services.
Okay.
So they're actually physically doing the job that they've been taught, the skills as well as the knowledge base in the classroom.
Is this the last semester of the program when this happens, or does it happen throughout the...
Happens throughout. The basics finish their classroom, and then they go to clinical. And as the AEMTs finish their classroom component, they go to clinical, and then there's 3 clinical components associated with the paramedic side.
So they're out there learning really the whole time.
Exactly.
You know, and so this would be, for someone who's looking for a fast-paced environment, getting involved right away, this is something that you might want to consider, correct?
No doubt.
Yeah.
No doubt, if that's something you want to do.
Vickie May, thanks for joining us here on The Topic and telling us more about the EMS program and how to train to be an EMT. If you have more information or you'd like to learn more about this, it's very simple. Log on to hccs.edu/EMS. For The Topic on HCC TV, I'm Todd Duplantis. I'll see you next time.